Hi, this is Taryn Grome, editor of Pharma Voice. We met with numerous inspirational thought leaders at this year's DIA annual conference as part of our Editors Take video series. I hope you enjoyed this discussion.
In this episode, Taryn meets with Matt Kibbe, President and Chief Innovation Officer, BBK Worldwide, and Thomas Klein, Founder and CEO, Be the Partner.
Gentlemen, welcome to Philadelphia and the 2016 DIA Annual Conference.
Thank you. Thank you very much for having us.
How can we use the new connected M-Health model to increase patient engagement, Matt?
In many, many ways. I'm just going to give you one example. At our booth today, we are giving away virtual reality viewers. And a lot of people have been asking me, how is this related to participation in clinical trials? And so the answer I've been giving there is, well, the use of mobile phones, for example, is ubiquitous. And so by just placing a mobile phone in one of these viewers, we can actually engage and immerse people in education about participation in clinical trials. So, for example, if somebody is thinking about the informed consent process, or looking at the anatomy of the human body, or trying to understand in a gamified way what participation in clinical trials is going to be like, perhaps even thinking about what's it like to be an MRI machine. You can try to envision what that's like within the virtual reality space, and you can do that just through a simple viewer. And that's one application.
Thomas, from the perspective of Be the Partner, how are you seeing this trend emerge?
Yeah, so we offer patients so they get back their data from a clinical trial, and this is something very important for the patient, because it's the first time that the patient is really a partner of the pharma industry, getting back his or her individual health data at the end of the trial. And the patient, we don't give it back in a way that's a graveyard of letter of numbers. It's an account on the web, so the patient can give access for the PCP or specialist for second opinion. They can drill in and use these data.
We'll stay with you, Thomas. How can we take the risk out of the adoption of M-Health innovation?
We must make it very user-friendly. It must look good. People must have, the consumer finally is the patient. We must have the feeling this is useful for me. So that's why we start with giving back his or her health data from the clinical trial for future use, and this may be help for the adoption.
Yeah, I would agree. Having a really good patient-centered user experience is key. But also, I was giving a talk yesterday, and I was just really giving a nod to the clinical teams. The clinical teams have been the people who've been taking a risk with these sorts of things, and they're the ones who are pressured to perform. And many times they'll be asking, how can we de-risk this activity? How can we increase adoption? How can we increase stickiness in these apps so that we have a really good experience? Well, many times someone will buy an app or some sort of other application, and they will just leave it to chance to people to adopt it or to stay with it. If you can increase the support, the awareness for that app by including it in investigator meetings, making it something that the CRAs are pushing with the sites, putting people into email workflows, reminding them of the service, that's great to encourage adoption. But when people have adopted it, the stickiness then becomes an issue. And then content is king. You have to have information in there that will keep people coming back, fresh information that's relevant to them in an easy to retrieve format, as Thomas had said. So that's where Thomas comes into it too, because content is king. Well, there isn't much more king to the content of someone's own data and being able the data returned to them as well. So I love the idea of how that works together.
Everybody's talking about patient-centricity. Beyond the benefits to the patient, how will M-Health help others in clinical research?
So others will be, for example, the investigators or the site staff working with the patients. This is a big thing in M-Health for the future, that they have a more or less online contact to each other, have it much more feasible to speak to each other. So this is one case. The other case is that, like with the patients platform we share here with patients and the sponsors, they can talk to each other as well without jeopardizing the de-identification.
Matt, you want to take us home?
I just want to echo what Thomas had said there, and we're certain it's going to help physicians. having access to real-time data so that they can optimize treatments of patients. For example, we're working with a company called Atomics now that can offer patients with Parkinson's disease real-time feedback into how their medications are actually working for them, so they can optimize treatments in the moment rather than just at a snapshot when they come into the physician's office once, twice, 3 times a year. And so I think that that's really a big benefit for those doctors. The other benefit that I see also for the pharmaceutical industry as a whole is that these sorts of applications and devices can increase enrollment rates, they can increase retention into studies, and therefore it's going to achieve the goal, or help to achieve the goal, of making clinical trials faster, better, and getting patients access to treatments that have been approved more quickly.
I want to thank you both so much for sharing your insights with us today for our Editors Take Video program.
Thank you
You're
very much.
very, very welcome. Thank you.
For more information on this topic, visit our Thought Leaders website.
For more Editors Take Videos from the DIA Annual Conference, visit www.pharmavoice.com. Thanks for joining us.